Let's talk about writing needs assessments. This is an overview, and then we'll delve a little bit into the individual components as we proceed through the module. So first of all, I'm going to show an example of a needs assessment, and this is just a needs assessment. It's generic. In terms of its format, it's pretty standard. So we have a title, we have an introduction and a statement of need. And just as a matter of interest, this is about neurofibromatosis type 1 and F1. Introduction, statement of need. Let's scroll down. So in the needs assessment, you have oftentimes a table where you have the gaps in knowledge identified. So you can see here there's 3 gaps that have been identified. So the first one is that clinicians are unfamiliar with the complex molecular drivers of NF1 related tumor development and the role of MEK signaling in this process. The second gap in knowledge is that clinicians do not recognize the early dermatologic signs of NF1 in pediatric patients, leading to delayed diagnosis and management. So that's actually pretty easy to substantiate. And we'll need to do that when we write up our gaps. And then the third gap that's been identified is that clinicians may be unaware of recent clinical data supporting the use of MEK inhibitors and other novel agents in children and adults with NF1-associated tumors. Okay, so those are the gaps. And then you have the corresponding educational need that should align with the gap. So the need, given this gap, what is the educational need? Clinicians require foundational knowledge. And so it's supporting the idea of an educational program. And then the learning objective from the program is that you want the clinician to be able to explain the underlying pathophysiology of NF1. All of these rows correlate with the gaps, and that's how you write a table. And then we have, again, our gaps. So this gap 1 should match what's in the table, and it does. And then you have the write-up, and you can see there's maybe a few hundred words to describe that gap, substantiating the need. It is essential that clinicians are aware of the range of diverse pathology attributable to loss of neurofibromin function. So you're substantiating, you're saying, you're not just doing a data dump. You provide some description of the science, but you're saying you tie it always to the educational gap and how that needs to be addressed with your educational program. Gap 2 is the same as in the table, and there's a few words about that. You can see here, everything is fully referenced. And then gap 3, also the same as in the table. And then this is unaware of recent clinical data supporting the use of MEK inhibitors and other novel agents. And so this is sort of an outline of the approved agents. Mirdametinib is the sponsor's agent, so listed that first, and that's reasonable to do so. It was just approved. We also talk about other agents, selumetinib also approved. You can also put these in a table if that makes sense to do that. Makes it more succinct. And then we also talk about emerging therapies. We always want to differentiate between what's been approved by the FDA and then what's emerging. So it's in late stage clinical trials. You probably shouldn't include anything less than a phase 2 trial when you're talking about these. You don't want to talk about phase 1 trials in needs assessments because those are kind of unknown entities. So these are the emerging therapies: binimetinib, cabozantinib, which is approved, but just not for NF1. All right, so those are the main agents, and we'll talk about how to research these agents, find out all the information, but you want to make sure you include them. You definitely want to include the supporters agent. If I've seen needs assessments come into Nascent where it hasn't really mentioned the supporting company's agent, and that is a needs assessment that is, first of all, the client's going to be upset with you, and secondly, if it gets past the client, it definitely won't be funded by the pharmaceutical company. All right, and then you put a concluding statement. So the existing educational gaps in this area support the need for a program that will update knowledge among clinicians. So this is pretty standard language. You want to tailor it to your disease state and make sure that you tie it to improving outcomes for both children and adults living with NF1 or whatever your disease is. All right, so that is your needs assessment. This entire document's about 3,700 words, like to keep it around there, usually, depending on the format. Sometimes they like them a bit shorter, but never really longer. You don't want some unwieldy document that the client has to deal with. They're just going to ask you to cut it down. So 3,500 words is pretty standard, but definitely clarify that with your client if it's not clear from their example. All right, educational agenda. So that's the outline for the program that you're going to do based on what you've talked about in your gaps and how to address those gaps. So here is this. And these are different formats. Usually, sometimes you have if the program is supposed to be an hour long, you can break this up into 10-minute segments or whatever it would be to add up to 60 minutes. But again, you're going to need a sample from the client so that you can follow their format for their specific educational program. Proposed faculty. These are faculty that you can suggest, and I'll talk about this more in a lesson. I just use a prompt and I put ChatGPT on web search, and it usually provides me a nice list of people that have participated in similar programs. So that's what you want. And then here are the references. All right, so that's an example. And then just to talk about the purpose of a needs assessment, it's to identify and justify the need for a CME activity. But the key underlying point is that what you're trying to show for your client, who's the medical education company, you're trying to show that that medical education company has the scientific knowledge and ability to create an educational program for the pharmaceutical company, for which the pharmaceutical company is going to pay, hundreds of thousands of dollars. They want to understand that the medical education company is going to cover their agent and it's going to do it in a fair and balanced way. And so it's really kind of displaying the scientific acumen of the medical education company. So you want to focus on specific clinical gaps. What is it that the clinician is doing wrong? Not to be negative, but clinicians are learning all the time. They have so much to learn. What is it that they're doing wrong? Are they misdiagnosing? Are they not treating adverse events correctly? Are they not using as per directed guidelines? So not just knowledge deficits, but how does it actually translate into a deficit in patient care? It's hard to always substantiate these gaps, but that's what you want to aim for. You want to emphasize how these gaps impact patient care. And then overall, with your document, you want to present a compelling case for education as the solution. One thing I forgot to mention about these needs assessments, it's really important. There's lots of rules and regulations on these because they don't want pharmaceutical companies spending lots of money promoting their agent before something's even been approved, and it sort of doesn't align with educational goals. So actually, once a pharmaceutical company has given over $300,000, $500,000 to create an educational program, that pharmaceutical company is no longer allowed to have any input into the program. So that's a big deal, right? So they're putting out all this money. And so the only point at which they have any control in the process is whether or not to fund the proposal sent by your client, the medical education company. So that's what makes these needs assessments very important. So they have to be fair balanced, but they have to speak to what the supporter is looking for, and they have to be balanced and technically accurate. So all these things, very important document. All right, so when it comes to writing a needs assessment, you want to start by creating the framework. So you want to clearly outline your gaps. So you start out with that table that I showed you. You have the learning objectives that correlate with the educational gaps, and then everything else becomes, the framework upon which you hang the writing and the references and all of that. And then we'll also talk about research and evidence gathering in a separate lesson because it's very important. But at least a quarter of your needs assessment writing will be actually spent researching and gathering information and looking at the supporter's website. The first thing you do is you find out who the supporter is because that's a question that you need to ask. and you understand why exactly they're putting out a request for proposals at this time, there's always a reason that they want to spend multiple hundreds of thousands of dollars on an educational program. There's always a reason. So you need to know what that reason is when you're writing your needs assessment so you address it properly. The next step I would say is to do a Google News search on your topic. So when I showed you that example, NF1, do it on that, see what's happened in the news, not just a Google search, but a news search on the topic and the class of agents, MEK inhibitors, for example, and see what's recently happening. That will pull up the latest data, FDA approvals, any big conference presentations. All of those need to be in your needs assessment. Now, you want to use pivotal clinical trial data to support the need. This is maybe in the press release section of a supporter website. You do not want to reference a press release in your references. Go to the actual trial. Maybe it's presented at a conference, or maybe it's been published. If it's been published, you want to use that version, not what was presented maybe a year ago at a conference. Okay, so always use the latest data and the most peer-reviewed data, and do not use commercial press releases and things like that. Search relevant editorials from PubMed to add expert content. So let me just pull up PubMed. So let's say we want to search neurofibromatosis 1. Okay. Whoops, I spelled that wrong, so it's not going to work well for me. Okay, there we go. Okay, neurofibromatosis 1. All right, search. Now, if I search it, it's going to bring up 12,228 results, and we do not want that, so we can filter it. And if you're in science, you for sure are familiar with all of this. But what you might could do is just click for editorials, and then you'll get 79 results, and you can support it by best match, or you can support it by most recent. And most recent may not give you the best match, but it'll give you what it is all going on in the field. And so you can see different editorials might have useful information about, what is the current thinking, and this will be written by a key opinion leader. You could use the editorial. Oftentimes they're not full text, so that can be a problem. But occasionally it will be free text, and you'll be able to use that perhaps as a quote in your piece. So editorials can be helpful. You can also look at review articles. And let's do this by best match. Review articles. You can see what's going on. This might be a good one. Okay, that's a little old. So about the age of references, I wouldn't go, unless it's a really classic reference, I wouldn't use anything older than about 3 years at this point for most topics. You want to really stay current with everything. And then I would also say in the RFP, which is a PDF document that's provided by the pharmaceutical company, I've seen everything from, ChatGPT fake references to really old references. So you should actually look at the list to make sure you include anything important from there, but you still want to stick to your validated references that are current and relevant and actually legitimate references, not generated by ChatGPT. I literally saw made up references in a RFP, and I couldn't help but think that that was some kind of test from the pharmaceutical company. So just be really careful. Everything still has to be extremely accurate, as with all medical writing, even if the pharmaceutical company put it out there. And then another thing that you can do that's often helpful is to search for other recent CME programs on the topic to just sort of give you some insight. Okay, so let's say we have neurofibromatosis 1, CME program, MEK inhibitors. Okay, let's just see what that pulls up. Go past the sponsored one. So you can see here's one from a company. You can see what they did. It's not necessarily going to be aligned with what you're looking at, but it will definitely give you some information. You can see, okay, this was supported by a grant from Alexion and Springworks. I think that needs assessment that I wrote was for SpringWorks. So you can see just, what's covered. That's one of them. Here's another one. You just want to make sure you're not going to copy anything, but just want to make sure that you're covering the important things. And, occasionally clients don't even haven't researched the topic like you're going to research it. So it's up to you to communicate with the client if you think that maybe it should be in a different direction, right? That's the value that you add as a scientific person and a medical writer. Just don't blindly follow what the client says if it seems like something else should be covered differently. Other considerations, use the client's preferred format. You should not write a needs assessment unless you have a sample needs assessment from that client or you're familiar with it already. Confirm. For example, should you use superscript numbered references or should it be alphabetized, first author, last name, and year? So it can be done that way. So just do what this sample shows. Make sure this text is sufficiently detailed and tailored towards a scientific audience. You're trying to make the client's scientific ability shine, show that it's sufficient to do this educational program. You want to review the final draft to ensure clarity, relevance, and persuasiveness, of course. I always run a spell check and also run it through Edit GPT, which is a Chrome extension, very worthwhile. Cut and paste the thing and put it into Edit GPT. It'll catch a lot of things that a spell check won't. And you want to confirm inclusion of all the requested information initially given to you by the client. So that's needs assessments. And, it seems kind of overwhelming when you first sit down to a blank page. You've got to write 3,500 words and provide a compelling, need for this educational program. And it does. It takes, at least 15 hours, and that's going full speed ahead, maybe with a little assistance from AI. So, as I'll show you. So definitely, these aren't the best paying. You might get a flat rate of 1,700, 2,000, which is good, but it is going to take you, 17 to 20 hours if you're doing it right.